What would you say were the particular strengths that really helped your service get through the pandemic?
The strength that helped us get through it was actually the support from yourselves, obviously, and the parents, the carers.
Yep.
They were, a massive support for us during the pandemic.
And what about in terms of the staff? What sort of different supports did you have in place for staff to help them? Because it was obviously quite a challenging time for them as well.
It was a challenging time for them as well. We've done a lot of training. Obviously, all our staff are fully qualified and first aid trained, and they've done COVID training while we were there. We've more than one service, which meant we were there to support each other.
Yeah, getting that kind of co-support from different services under the same group. Yeah. And have you kind of noticed any changes in the way that children are using spaces or in the way they're interacting with staff? Any differences as a result of the pandemic?
Well, the children seem to be kinder to each other, to be honest with you, since the pandemic. And also we've got the outdoor area, so we did use that a lot during the pandemic for the children. We had all the loose parts, etc. out there that they could just go out there and help themselves, play with us with whatever they wanted to play with. So
what are some of the if it'd be good for you, I think, to share some of the positive work that you've done with children and families, during the pandemic, post-pandemic, what do you think is really making the difference at the moment?
Everyone adjusted very quickly, considering the pandemic. Now as we're recovering, we have to get used to being more open again. The problem with during the pandemic, the parents weren't allowed in during the pandemic. Yeah. And it was hard for new parents, primary ones that were starting and they hadn't even seen the halls. So it was great when we get back, that then meant we could give them a tour of the building, and it meant them, they felt a bit more safer knowing that their children were, safe there. We've got a member of staff that does an art workshop. When we first started, we used to do that workshop maybe 2 days a week. But as we get busier, more and more children wanted to go to that workshop. So we now have the art workshop every day. And also the art workshop, one of the times we had, I think you actually were out that day, that we had the exhibition on for the parents, for art exhibition, that we'd also done an afternoon tea that day for the parents, and that was good for the parents to come in and see what their children have been doing.
Yeah, absolutely, and that wouldn't have been possible during COVID because we were saying some of the things.
No.
So do you think that's been important, or what difference has it made being able to re-engage with families more after the pandemic? It's been great, because although you speak to the parents at the door or whatever, when during the pandemic, the parents weren't allowed to come in to pick their children up. Who are you looking forward to kind of working with and re-engaging with in the community now that we're kind of coming out of that? Well, we've just at Christmas there, we have a choir, and the children, it was good because they get out to go to the care home, local care home, with the choir. And they were delighted to have them back, because that was like 2 years that we've not been able to do anything like that. Yeah. And I think, obviously, we understand, we all understand that recovery from the pandemic and from other things that are going on in families' lives, recovery from the pandemic will take time. So what do you think still needs to be done? What support is needed from the care inspector or from other bodies to help with that? I've had exceptional support during the pandemic from the care inspectorate, and all I can say is if they could just continue to do so. Yeah, because we've probably had a little bit more involvement with services and more contact. Yes. Yeah. Yes. Absolutely.